Good evening, everybody. This is Kusuma M, member of Shivi Forensics. Today's presentation topic is about injury analysis. Content that we are covered in the topics are introduction, definition, classification of injuries, mechanical injuries, thermal injuries, chemical injuries, firearm injuries, pattern injuries, defense and hesitation wounds, injury documentation, role in crimes in investigation, medical legal aspects, case example, conclusion and reference. Introduction. Introduction to injury analysis. Injury analysis is a key part of forensic science. It studies the nature, causes and timing of the wound, help identifying weapon use, type of forces and reconstruction events, supports law enforcement and legal processes. Injury analysis is a virtual aspect of forensic medicine and criminal investigation. It involves a systematic examination of the wounds or trauma of an victim body to determine the type of causes, manners, and timing of the injury. This process helps in understanding whether the injury was accidental, suicidal, or homicidal in nature. Forensic experts analyze the location, shape, depth, and pattern of injury using medical knowledge and scientific techniques. Injury analysis not only assists in identifying the weapon or object used, but also helps to reconstruct the sequence of events during the crime. It plays a crucial role in criminal trials, insurance claims, and accidental investigation, making it an essential tool in the administration of force. Next, definition. Definitions. Injury analysis is a systematic study of damage caused to the body, forces on physical, chemical, thermal, and biological agents, aims to determine the type, causes, and manner accidental, suicidal, or injury. Classifications of injury: mechanical injuries, thermal injuries, chemical injuries, firearm injuries, electrical injuries, and biological injuries. First one is mechanical injuries: abrasions, surface cracks from frictions, contusions, bruising from blunt force, laceration, torn tissues from blunt force, incised wound, clean cuts from sharp objects, stab wounds, deep, narrow, injuries from pointed objects. Next one is thermal injuries. Burns classified into first, second, and third degree. Scalds caused by the hot liquid or steam. Frostbite, tissue damage due to the extreme cold, used to determine exposure, the timing of forensic cases. Chemical injuries, acids or alike burns causes skin corrosion and disfigurement. Injections of poisons, internal damage, common in acid attacks, suicides, and poisoning, indicates a premedication or intent. Next one is firearm injuries. Entry wound and exit wound. Entry wound are small, round with interved margins. Exit wounds are large, irregular, extroverted edges. Close range firing shows up. Blanking of tattooing or GSR means gunshot residues. Help determine the weapon type and object distance. Patterned injuries reflect the shape of the object used. Examples are belt and rod, useful in matching weapons to injuries. Examples are shoe prints, tool marks, and firearm burns. Defense hand hesitation wounds. Defense wounds, usually on arms, hands, indicate struggle. Hesitation wounds, shallow, multiple cuts, and common in suicides. Help determine the manner and intent blunt injuries. Injury documentation. Proper forensic documentation includes that are description of the wound, size, shape, and depth, photography with the scale, injury maps or diagrams, notes on healing stages of timing analysis. Role in crimes in investigation. Injury analysis helps to reconstruction the sequences of events, identifying the type of direction of the force, distinguish between accidental, suicidal, and homicidal wounds, supports or contradict of witness statement. Medical legal aspects of injury analysis. Injuries are extreme to access of causes of death, time scenes of injuries, legal classification, grievous hurt and murder, culpable homicidal, Findings are used in legal proceedings and testimony. Case examples are acid attack, chemical burns indicate international disfigurement, hammer attack, patterned injuries match tool, gunshot cases, GRS provide close range fire. Each case highlights a forensic linkage between wound and weapon.
Conclusion: Injury analysis bridges medical science and criminal investigation. It reveals the truth behind wounds, weapon uses, and intent, plays a virtual role in justice delivery and crime resolution. You can Google it, the references. Thank you so much for watching the video.